So, what's your name?
Virginia Pimet.
I never knew how to pronounce your last name, but that's good to know. Do you remember how you were referred to us?
Actually, it was a friend of mine who works for a heart doctor, Nora Hernandez. Your cards were in their office, and they're in Pearland.
So, what kind of accident did you have?
I had an accident in the rear end of my car that totaled my car out. The guy that hit me said he didn't, I don't know how, but he did not see me until he hit me. And I thought, how does that happen?
Right.
I mean, it wasn't dark. I mean, sun was setting a little bit, but it wasn't dark.
After you had that, you were hurting. How long did you hurt before you decided that there was something wrong?
Probably about 3 days, 2 to 3 days. I didn't even know I was hurt. I was so shocked. Well, the only reason I knew I hurt is because I had something on my knee, like a scrape, and then right back here, I had a knot. Mm-hmm. And I didn't even feel it.
At first.
At first.
Yeah. And then what kind of symptoms it started happening shortly thereafter?
Right in here, I had a knot, a big size knot, and that's when it started hurting. And then next thing you know, my neck's bothering me. I mean, it was just like, I couldn't believe it.
Yeah, yeah. And of course, you came here and we checked everything out, and were you surprised that your neck bothered you during the exam process?
Yes, I was.
Okay. And your back a little bit.
Uh-huh.
Okay. And then I guess one of the first things we started doing is treating your foot. So tell me about this foot problem you've been having for, how long have you had the foot problem?
20 years, maybe.
And tell us what that's called.
Neuropathy.
Okay. And it caused a Charcot foot.
Uh-huh.
Right.
This particular foot.
Yes.
The worst one.
The right one.
I have a little neuropathy in this one, left, but the main is this right foot.
And to your knowledge, how did you get that neuropathy?
Well, it's my diabetes,
yeah.
That's for sure. But the Charcot foot came from a television dropping on my foot.
Okay.
And it fractured the foot. I
see. And then it didn't heal really well, partly because of the circulation.
Right.
And then partly because you can't feel. When it hit your foot, did you feel that, or did you already have significant neuropathy and you didn't really feel it as much?
Oh, I felt it because TV was about like this, one of those 56-inch television.
Okay. And so you felt it.
Yeah.
Yeah, but it broke it.
Yeah.
Broke and fractured your foot.
I fractured it. I didn't realize that. It just started swelling a lot, off and on.
Right.
And I would lay in bed with 4 pillows up and it would go down. But then it would just start swelling again.
Right. And the Charcot foot develops because if you lose muscle function, balance, nerve function, and then all the bones start kind of deforming as a result. So that happened from that point for the next, say, 20 years.
Uh-huh.
Okay. Now, after the accident, we started treating it with stem wave. What did you notice after we started treating it with stem wave?
I started getting feeling a lot.
Okay.
I mean, it was a big difference. Difference. And that was maybe after only the second or third time you used it.
And how did that affect you when you started feeling it more? How does that impact your quality of life?
A lot, because it made it difficult for me to think about driving. I almost gave it up.
But now that you can feel more,
I can slam on the brake, feel everything. I mean, it makes it a big difference. Really did.
That's really good. Did. And nothing that you had done up to that point had made any difference in your foot. Right. That's pretty good. And then how are you progressing with the sensitivity of your neck and your back at this point?
It's better. It's better.
Feel the neck and back pain. Mm-hmm. That's good. Has the color of your foot changed at all since the circulation has been a little bit better? Have you noticed anything with that?
Not as red.
I actually noticed that too. When I first saw your foot, I mean, it was really red. Yeah, really, really red. And so the color has improved.
It's come back.
Yeah, it looks way more normal like the other foot. Yeah, it's good. And when we're doing the stem wave treatment on your foot, what does it feel like?
Well, I can feel it, but it doesn't hurt. It feels like it's being rubbed.
Yeah,
Uh-huh.
yeah, which feels good.
Yes.
Yeah,
For
yeah,
me, it does.
right.
I mean, you warned me it might hurt, but it has never hurt.
Yeah, good. Just
It
feels
just
good.
feels like getting a rub.
Yeah, there you go. It's good. All right. Anything else you wanna add?
I'm just glad and feel thankful that I was recommended to your office.
Well, thanks for saying that. Yeah, we're glad to have you. We love being able to use all these tools for people who have been injured at no fault of their own, and they, we get to kind of roll out the red carpet with our massage services and decompression and this stem wave.
I told Nora too. I said, if anybody ever asks, you need to refer them.
Yeah, I appreciate that. And that's called peak injury clinics. That's we're a one clinic in the network of the peak injury clinics.
Oh, really?
Yeah, we have 10 clinics and a whole bunch of specialists and just a whole bunch of doctors we can connect patients with under the umbrella of peak injury clinics.
Oh, okay.
Yeah. Well, thank you for doing this.
Well,
and
thank you for helping me.
Yeah, you're very welcome. And it's our pleasure to obviously help you, and it helps other people by making these little videos, and they get to see that, oh great, there's an option, even for a person with a diabetic foot. Doesn't cure the diabetes, but the problem with diabetes is it restricts blood flow in the extremities, and then the nerves die off, and once that die off, that's the
That
neuropathy.
was it.
Yeah.
They die off except for when you get those shooting pains.
Yeah.
Neuropathy.
But that's the dying off process. Those shooting pains are the nerves kind of dying off, and then the numbness is the end result of it. Yeah. And it can be dangerous too from a health standpoint, because you can obviously get a cut or something in your foot, and if you don't know about it, it can fester and become
That's
a
true.
big problem.
That's true.
Yeah, so but feeling is good. Let's put it that way. Yeah, we need pain. We need feeling. All right, I think that's perfect. I want to thank Miss Virginia for entrusting us to come in and be seen in her situation. It is very common for patients who have been involved in a traumatic injury of some sort. Car accidents are a very common source of those traumatic injuries. It's very common for a patient not to know where to go and not to know what to do, and so she happened to go to one of the clinics that we work with, and they were kind enough to give her the card. She called us, and we were able to help her from there. And we end up having lifelong impacts on some of these patients, because if you heal incorrectly from an injury, and even the story that she told about her foot, TV drops on her foot, basically heals incorrectly. When you add comorbidities such as diabetes on top of that, neuropathy, she develops this Charcot foot, which became overloaded in the accident, and she had a lesion on the back of her leg. Somehow her leg impacted something in the car, and it opened up an actual lesion on her leg, which she didn't talk about very much, but the knot was what she was referring to. But visually, it was actually had a scab, and it was an open wound at one point. But that foot was overloaded in the accident, and so we were treating the foot for the fact that she couldn't hardly walk on it. She was limping severely. She already had a limp anyway, and thankfully we were able to use the shockwave technology to increase angiogenesis, blood vessel formation. That helps to kind of regenerate the nerves, and now she can feel her foot. And one of the biggest things that I noticed about her foot when I first saw it was the fact that it was very, very red, so it was very discolored, and now her foot is almost normal color. So we don't have the before pictures of that, but she mentioned that her foot coloring is much better as well. So in addition to that, we're treating the neck injury, the back injury. We're keeping those joints open and unloaded while the soft tissue around them heals, making sure that the posture improves, the flexibility improves, so that she can move, her neck and her back properly. And all of this has impacts on quality of life as a person recovers from a traumatic injury. So I want to thank Miss Virginia for taking the time to make this video, and hopefully it helps others understand what can be done following traumatic injuries and what we do here at Peak Injury Clinics and our actual clinic, Peak Performance Spine and Sports Medicine. So appreciate that, Miss Virginia. Take care.